what do you get when you have a for-profit healthcare system like the one we have here in the United States that not one single other of the 33 OECD countries has? What do you get? You get one hospital in Washington, D.C. that charges $115,000 to keep a patient on a ventilator, and another hospital in this same city that charges just under $53,000 for the exact same thing. You get one hospital in Miami that charges $166,000 for treating a heart attack with 4 stents and major complications, and another hospital in that city that charges around $89,000 for the same thing. For years, we weren't able to get a clear picture of what various hospitals charge for similar procedures. Hospitals have gone out of their way for years to hide what's called their procedure price lists, like they were national secrets. But not anymore, because the cat's finally out of the bag. Today, the Obama administration and the Federal Centers for Medicare and Medicaid Services released a database that shows for the first time how much the vast majority of hospitals in our country charge for the 100 most common inpatient procedures billed to Medicare. And when they released that data, this is all the claims for 2011, 163,000 individual charges recorded at more than 3,300 hospitals in 306 metropolitan areas. And the numbers paint a picture of a totally insane system. The prices for the exact treatments vary they're all over the map. And at random at hospitals, sometimes just a few city blocks from each other. Look at hospital costs in and around New York City, for example. The Huffington Post compiled data from the Centers for Medicare and Medicaid Services report to make a map of hospital costs for treating chronic obstructive pulmonary disease, COPD, in the New York metropolitan area. The range of costs to treat the same exact disease is where people, it's more deep, it's more extensive than people just get out of breath very easily, but that's the main symptom. But COPD, it's going to be a very serious condition. At the Bayonne Hospital Center, just over the Hudson River in New Jersey, treatment of COPD costs $99,690. Right across the river back in New York City at the hospital on the tip of Manhattan, that same treatment is $11,000. Looking at the entire New York City metropolitan area, the cost of COPD treatment ranges from $7,000 at a hospital in the Bronx to that $99,690 charged at the Bayonne Hospital Center. And it's all the same treatment. In major cities across our nation, the range of prices for similar or the identical medical procedures looks more like the ups and downs of a wildly volatile stock market. I mean, it's important to note here, by the way, that these prices that are revealed in this data do not reflect the prices that Medicare and insurance actually pay for the various procedures. Medicare and insurance companies pay what are called negotiated rates for the procedures. So they pretty much pay the same everywhere. Instead, what these numbers tell us is what the 49 million uninsured human beings, people in our country, citizens of the United States, have to pay for these various procedures out of their own pockets because they don't have insurance. They didn't negotiate a deal with the insurance with the hospitals. This data represents the dilemma that uninsured Americans face when basically trying to decide between, do I save my life by having this procedure done and live a life of poverty, or die? But the real takeaway from this new data should be just how absurd and crazy it is to have a for-profit health system. I mean, this is nuts. We used to have a largely not-for-profit system, not-for-profit hospitals, not-for-profit insurance companies. These were mainly required by the various states' hospital and insurance regulatory boards. Then in 1980, Ronald Reagan stepped into the White House and basically everything changed. Nonprofit and community-owned became evil, and for-profit and corporate-owned became good, and it was all about making a buck. Insurance companies and hospitals throughout the 80s and the 90s began turning into for-profit money-making machines. Doctors began forming their own practices as corporate entities, and physician costs began to soar. Prescription drug companies began to squeeze every last penny out of the American public. And, they cut that deal with Bush where, Medicare can no longer negotiate prices for drugs. So the cost of just about every other aspect of healthcare in the United States has skyrocketed since the Reagan era. And what we're left with is a for-profit, basically a Reaganomics healthcare system that charges inexplicable rates for common everyday procedures and lets prescription drug companies fleece the wallets of Americans while millions are forced to decide between life-saving healthcare or a life of poverty. Actually, they're forced to decide between life-saving healthcare and a life of poverty or death. If healthcare were part of the commons, if we were to say that healthcare is a right in America instead of just a privilege, none of this would be happening. We wouldn't have a hospital in the Bronx, New York, charging $7,000 for a treatment, and a hospital a few miles away charging thousands more for the same procedure. It is time. We must say in America, we're taking the healthcare system out of the hands of the corporate profiteers and the Wall Street tycoons, and we're putting it back where it belongs, in the hands of the American people. You know, Alan Grayson so nailed this thing when he said the Republican plan is don't get sick. And if you do get sick, die quick because it's less expensive. That's what we've got.